Health experts are urging people to take extra precautions to prevent pink eye infections. KwaZulu-Natal has seen a rise in a number of cases since last month, with 13,000 infections by late March. KwaZulu-Natal authorities believe there could be a link between the outbreak and possibly contaminated water. There are now fears that the outbreak could spread to other provinces, particularly Gauteng, as many holiday makers spent their holidays in the province. And for this discussion, let's welcome Rubeena Jadwat, a KwaZulu-Natal-based optometrist. Rubeena, a very good afternoon to you. Thank you so much for your time this afternoon. Firstly, just how contagious is pink eye and how is it spread? And how real then is the threat of the cases now being spread into other provinces following Easter holidays?
Hi, how are you? Nice to be here. Thanks for inviting me for this interview. We are KZN inland and we haven't experienced that as many as they've had at the coast. So we were on hockey tour last week and we had a lot of schools there on the coast, in Toti particularly, and the kids didn't go to the beach, but they all went to the splash park and pools at the hotels. And for that reason, many of them had an upper respiratory tract infection, and that also led to pink eye after a couple of days. So I'm seeing a link between the water, that's for sure, because those of us who didn't swim didn't get it. And it's spreading quite fast. I've spoken to a couple of doctors in Newcastle, pharmacists, even the Department of Health, and they said the number of cases in our area has now started to increase since the holidays have finished.
Look, Rubeena, take us through the symptoms as well as treatment options that are currently available for pink eye.
Symptoms, you get a painful eye, it's red. The one we're seeing at the moment is mainly viral, which means it's a watery, tears a lot. The eye itself becomes quite red and it's actually uncomfortable, like a sandy, gritty feeling all the time.
And what are some of the treatment options available, whether at home and, of course, in the hospital, Rubeena?
So the hospital, the doctors and us ourselves are administering antibiotics for the patients. Chloromethicillin or Chloromax eye ointment, Broline, all those are antibiotics which help to treat it, but it's a viral. This time it's viral conjunctivitis, which means it has to pass through the body like a normal flu, and it's taking between 8 to 10 days to pass.
Very interesting indeed. So, Rubeena, maybe we should have started with this. Is there an actual medical term for a pink eye? What is it called in terms of the original medical terms? And then, can the infection go away on its own without medical treatment? And are there any ways to actually prevent the infection?
Yes. So it's called conjunctivitis. There's many different types of conjunctivitis. Conjunctivitis is the clear layer that actually covers your eyeball, and that layer is actually called your conjunctiva. And when you have an infection or a viral infection like this, that clear layer gets engorged or swollen, and the vessels become quite big. So that's why it looks very red and pink. So we can prevent it by using, not sharing. It's very contagious. So you don't share your towels, you take your pillowcase and change it daily. And they say when you have pink eye that's this contagious, you rather stay at home. Don't go to work, don't go to school, because just a cough, a sneeze, you touch something that someone else has touched and it's over, you've got it already. And it goes from one eye to the next very easily.